connect climate change and healthcare.
It's always been about protecting people.
As good stewards of the environment and also solving their water shortage issues.
Green energy is one path that's well worth taking.
I learned early on that you pay close attention to what the nurses have to say.
Hey everyone. Welcome to podcast 2 of Truth, Courage, and Solutions. I'm your host, Corey Olson, LPN. In this episode of the podcast, you will hear a discussion with planetary health expert, Dr. Teddie Potter. She shares her journey into becoming a planetary health expert and her passion for climate change in healthcare. She also gives some great advice on handling challenges in life and how we can all do little things to better our climate. She is deeply committed to climate change and planetary health education and is an expert in many areas pertaining to climate change and planetary health. Teddie Potter first describes planetary health and touches on the 9 planetary boundaries.
Today we have Dr. Potter. She's a clinical professor at the School of Nursing at the University of Minnesota, and she's the director of planetary health. Dr. Potter is deeply committed to climate change and planetary health education, including membership in the Alliance of Nurses for Healthy Environments and membership on the American Academy of Nursing Environment and Public Health Expert Panel. She's a member of the Coordinating Committee of Columbia University's Global Consortium on Climate and Health Education and a fellow in the Institute on the Environment at the University of Minnesota. She chairs clinicians for planetary health and is a member of the steering committee of the Planetary Health Alliance at Harvard. She currently serves on the National Academy of Medicine's Action Collaborative on Decarbonizing the U.S. Health Sector. In 2019, Dr. Potter was appointed the first director of planetary health for the School of Nursing at the University of Minnesota. Dr. Potter, we are so delighted to have you here with us today. How are you?
I am doing great, and it's an honor to be with you today.
Oh, thank you. My first question for you is, how did you end up in your role that you're in right now?
That's a good question, and I get asked it a lot because a lot of young people want to be planetary health nurses. And so it's a little bit of a journey. I've been nursing for quite some time, but if you follow the red thread of my career, it's always been about protecting people and keeping communities safe and providing as healthy of a future for our citizens as possible. So graduated from St. Olaf College with a baccalaureate, and I then nursed in the community as a home care nurse for 30 years. I was one of the first HIV/AIDS nurses, because that was a group of people that were not receiving adequate care and adequate support. And so I created an interprofessional team care for that group. And then I turned that sort of model into caring for people with chronic renal and heart disease. And that became palliative care. And then I went back and got my master's, started teaching, and then I went back and got my PhD because I really was interested in transforming systems. So I've always been interested in how do we create as healthy of a society as possible. And that just led me to be very early involved in recognizing that the environment was going to have a huge impact on the health of humans. And from there, I just kept growing my career and being involved in developing planetary health as my specialty.
Wow, so a long journey, but a good journey for sure. What was that like for you? I mean, it sounds like this was years in the making. So did you come across any barriers to get where you're at? Or it sounds like you definitely had that inspiration kind of leading you, but how was that journey for you? I mean, did you question where you were going to be, how you were going to end up in the position you were?
You know, this is a question that I think is really important for people just starting in their careers to realize, is that we aren't given a full sort of blueprint or master design of what we're going to do with our lives and our career. Oftentimes we just are given the very first next step. And there's nothing wrong with taking the next step And when you take that next step, oftentimes other options open up to you that you hadn't imagined. And then you take that step, and that opens additional doors. And then you take those steps. So very, very rarely do people have a full plan baked into them. They might have a vision or a mission that they want to work with children who have cancer, or they want to work with the elderly to improve their quality of life. But very rarely do they have the full path of how to get there. Challenges along the way? Not really. I was very much committed to nursing and helping societies heal. Certainly, there were little roadblocks, but I often found that if I was creative, those roadblocks disappeared.
It sounds like it's been a very beneficial journey for you, like just getting to where you're at today. And it sounds like you've definitely taken those steps to kind of work towards your end goal, which is amazing. And clearly you're very established and successful in doing so with all of the titles that you hold and all of the groups that you work with and are a part of. So it's so great to have you here today.
Oh, well, thank you. I want people to know that nursing is an amazing field, an amazing profession that will allow you to go many different directions. And that there have been days certainly that I wish I wasn't at work, but never once in my long career have I thought, I wish I weren't a nurse, or that was a mistake, or I wish I had made another career decision. Nursing allows us the full range of really creating change in our society, and it equips us to work in different settings with different people, from local, our neighborhood, to all the way to a global reach. So to those of you who are just studying nursing and getting your way through these exams, it'll be well worth it.
That's such good advice and much needed. I can speak personally, and I currently have no idea where I'm going to end up after I'm done with school. And it's good to know that, there are a lot of options out there. And as long as you just keep taking those steps forward, you'll get to where you need to be.
And I think it's probably easier for you to know where you don't want to go, the things you don't want to do. But, just get out there and try something. We aren't locked into our career path like some of the other health professions. Once you get in it, you sort of have to be there the rest of your career. You can fall in love with caring for, children, and then you might decide, I want to try my hand at caring for elders. And then you might think, I want to be outside of acute care. I want to try public health, or I want to move from Wisconsin to California. The options are unlimited for you, and there's nothing wrong with trying multiple different paths and routes.
That's so great to hear. It's reaffirming to know that eventually it'll all work out. It might not feel like it at the moment for me, and I know for some of my classmates too, but it's very reaffirming to know that it's going to be okay. We'll get through this, and the options are endless, which is one of the many things that drew me to nursing. My undergrad is not in nursing, which is why we're in this DEMSN program. And just the options within the nursing field and how far you can go, like how much personal growth you can have, is just crazy to me. And it really drew me into the field of nursing, and the options are really endless.
Right. And for you as MN students or master's students, I think it's tempting for some people to say, oh, you made a wrong turn. You started one field and then that was not right for you and you chose nursing. I want to challenge that thinking and say, you were just getting different tools along the way that will help you in nursing. So you will be spectacular nursing leaders because you come with a breadth and depth of knowledge and expertise in another field that you're now bringing into the healthcare arena. And that's going to be a wonderful, wonderful contribution to healing our broken system.
That's a very promising response. I appreciate that. We've been told similar things along the way, and I think we're just starting to realize really how much our different backgrounds can offer to the field of nursing. And just within school itself, we bring a lot of different perspectives in And it's been fun to learn and see how everyone's perspectives are kind of changing the way that they think and kind of forming their nursing identity. So it's been really fun. It's been a fun journey. We graduate in May, so we're nearing the end, but it's been a good experience. So I want to shift a little bit now that we know a little bit more about you and we've gotten some amazing advice. So you are kind of focused on planetary health, and I'm wondering what that means to you personally.
Sure. Because planetary health is relatively new, I just want to take a moment to define it so that the people listening to this will understand what it means. Planetary health is actually an ancient way of being. The indigenous people all over the world understood that you needed to live in balance with your environment if you were going to be healthy and if your future generations were going to be healthy. Somewhere along the path, the timeline, some cultures lost that way of knowing and began to feel that the resources of the planet were unlimited, that the planet could never be impacted by human behaviors, and that we could extract and mine and log and dam up rivers to our heart's content without there being impacts. We're now seeing that those impacts are huge, that the human behaviors are causing disruptions to the Earth's natural systems. In fact, there are 9 sort of thresholds or boundaries that cannot be exceeded and still have the planet be able to support life. And we've already exceeded on a couple of those factors and are getting very close to exceeding on others. So planetary health is not just about climate change. It's about understanding that human behavior is causing a whole host of problems that are becoming very, very manifest right now. Climate change certainly is one of them, but biodiversity loss is huge. Lands becoming desert because we've deforested them, collapse of our fisheries, pollution of our air, water, and soil, toxins in our water and system, in our foods, food scarcity. I'm probably making you all just sort of hold your breath and think, oh my gosh, why'd you ask somebody so gloomy to be on your podcast? But planetary health, the whole movement, is about finding solutions, and it's about transdisciplinary working together to solve these great issues. And so it's not just about nursing and nurses and physicians and pharmacists and dentists. It's about all the health professions, but also about law and education and agriculture and music and arts and dance and every system, every human system. It's about rethinking how we live upon this planet and how we live with the other beings on this planet. It is health, absolutely. All these things I mentioned, climate change and biodiversity loss, all of those have impacts on human health. And we're seeing that right now. Just as an example, I have a picture of 4 different Lyme's bullseye rashes that occurred in my family just in July and August. My son got Lyme's out in New York, and then he came here to Minnesota and he got Lyme's again, and my daughter got Lyme's, and my grandson got Lyme's. That is not normal to have our vectors exploding like that. And certainly the pandemic has also raised people's attention that we're messing with our balance, and we have to, that balance has to be restored.
Yeah, it sounds like it's a huge project that we're going to be facing in order to reach that goal of kind of increasing and bettering planetary health and overall well-being of the different systems that are within the planet. So are there specific projects that you're working on to kind of face these barriers? And like, it's obviously a big project. So are there specific things that you're working on within your position now or in other areas to kind of face this?
Well, certainly, this is a project that's far bigger than Teddie, and far bigger than the University of Minnesota School of Nursing, or bigger than Minnesota, or bigger than the United States. This is going to take every single person dedicating their skills, their knowledge, their abilities to working together to solve these problems. So what I'm working on right now is bringing people into the movement, bringing people into an understanding of our health is threatened. Future generations are threatened unless we take action now. And that the action Riley takes is going to look very different than the action your colleagues take. You're going to be doing things that align with who you are and where your skills and abilities are. And it's helping people discern what they can do and what contributions they can make. So, for example, those of us that are heading into healthcare, we need to get our act together in healthcare. We contribute about 8.5% of the United States greenhouse gases, just our healthcare system alone. So we need to be working on that because we know that climate change is putting our patients at risk. We also need to be working on our disposal of waste. We generate a huge amount of waste using single-use plastics and wrapping everything and wrapping it again and wrapping it again and wrapping it again. Well, we need to look at that. Is that really, in fact, do we need to generate that much waste to prevent infection, but also be able to do procedures, et cetera? So a lot of things we're working on. As I mentioned, decarbonization is something I'm working on. We're working on informing the global nursing population that this has got to be a core aspect of planetary nursing, that we need to be nursing for the health of the planet. And we just developed an agreement with the International Council of Nurses. We're going to be writing a paper that will be released at their ICN Congress in July up in Montreal, calling the global nursing population to take action on planetary health. So those are just a couple of the things I'm working on.
It sounds like you have a few projects going on, not just a couple. It sounds like you're really trying to get this movement going. And I think that's so important. And it's so important on just that first step is just educating people, because I think a lot of people don't know what a difference just like the human population is making on the planet. I know that there's a lot of stigmas around climate change, and this is a little bit different because we're dealing with planetary health. It kind of brings everything together. But I think that first step is definitely just getting that awareness out and letting people, like getting people to know and understand what's happening around them.
That's exactly right, Riley. And most people see that there's changes, especially people deeply connected to the land, like our farming families and farming communities. They're seeing that there's unusual patterns that are occurring, and that the pollinators are not as high in numbers, that the water is falling on their land differently. So we see this, but what do we do? So in addition to informing people and helping people understand what's happening, another key feature is helping people have hope and to realize that if we work together, there are absolutely things that we can do. And it's not going to make life miserable for us. It's actually going to improve our health. So for example, by eating more plant-based diets, I'm not saying don't stop eating meat or stop eating anything, but orient our diets more towards plants, that actually improves our health. By people taking mass transit or biking whenever they can, that improves our human health as well as the health of the planet. So these things don't have to be giving up and cause great misery or hardship. They actually can improve our own health and the health of our families.
In this discussion with Dr. Potter, she mentioned a fundamental key to understanding the present and future for humanity. These 9 planetary boundaries that Dr. Potter referenced were created in the mid-2000s by Johan Rockström, director of the Stockholm Resilience Center. They gathered an interdisciplinary team of scientists from around the world to define these boundaries and what a safe operating space for humanity looks like. In 2009, the center then published the Planetary Boundaries Framework. These 9 boundaries are defined as boundaries that cannot be pushed without putting society at risk. The boundaries include climate change, biodiversity loss, ocean acidification, ozone depletion, atmospheric aerosol pollution, freshwater use, biochemical flows of nitrogen and phosphorus, land system change and release of novel chemicals. A reassessment in 2015 revealed that 4 out of 9 boundaries, I repeat, 4 out of the 9 boundaries, were already operating at an unsafe, at-risk level. As you all heard Dr. Potter referenced, they include the boundaries of climate change, biodiversity, land system change, and biochemical flows. The thought of not having access to clean water systems seems like a fever dream. Yet it is a reality many across the country face. High levels of nitrogen and phosphorus in water systems have pushed the limits in terms of planetary health and boundaries. It should be noted that in small amounts of both nitrogen and phosphorus, there can be healthy things which are good for the environment. The Environmental Protection Agency, or EPA, describes how both nutrients provide food and habitats for organisms and support plant and algae growth. It is the overabundance of these two nutrients that makes things go haywire. In terms of human health, groundwater pollution of nitrogen is harmful. Nitrate, a nitrogen-bound compound, is a harmful substance that is detrimental to human health. According to the Wisconsin Department of Health, nitrate ingestion is associated with thyroid disease, increased risk of certain cancers, increased rate of birth defects, and blue baby syndrome in infants less than 6 months old. How did we get to this point in terms of excessive amounts of nitrogen and phosphorus in our water systems? Well, the EPA states there are 5 primary sources of excess nitrogen and phosphorus. The first source is agriculture. The nitrogen and phosphorus in animal manure and chemical fertilizers are necessary to grow crops. However, when these nutrients are not fully utilized by plants, they can be lost from the farm fields and negatively impact air and downstream water quality. The second source is stormwater. When rain falls on our cities and towns, it runs across surfaces like rooftops, sidewalks, and roads, and carries nitrogen and phosphorus into local waterways. The third source is wastewater. Our sewer and septic systems are responsible for treating large quantities of waste, and these systems do not always operate properly or remove enough nitrogen and phosphorus before discharging into waterways. The fourth source is fossil fuels. Electric power generation, transportation, and agriculture are large contributors of increased nitrogen in the air. When fossil fuels are burned, they release nitrogen oxides into the atmosphere, which contribute to the formation of smog and acid rain. And finally, the last source is humans and their usage and improper disposal of things that contain nitrogen and phosphorus, such as fertilizers, yard and pet waste, and certain soaps and detergents. Now we know we have pushed the planetary boundary to its limit. But how do we stop it from permanently altering the planet and putting society at risk? On the next episode of Truth, Courage, and Solutions, we will discuss ways to address the nitrogen and phosphorus problem, and we will be joined by Autumn Fisher and George Blair. Stay tuned.
If you are hearing this message, you've listened to the entire episode, and for that, we thank you from the bottom of our hearts. We also want to extend our gratitude to our guest speakers who contributed so much to our understanding of climate-related health issues. The music you hear is Wanderlust by Scott Buckley, found on SoundCloud, promoted by Freestock Music Attribution 4.0 International CC by 4.0. A special thanks to Ayana Elizabeth Johnson and Katherine K. Wilkinson for their inspiration and guidance through their 2021 book, All We Can Save. From them came the framework for this podcast series, Truth, Courage, and Solutions. Viterbo University also gratefully acknowledges that it stands on lands and amidst waters stewarded by the Sioux, Sauk, Fox, and Hoocąk peoples. This has been an academic project of Viterbo University's Direct Entry Masters of Nursing Science students, 2022 through 2023 school year. We hope you enjoyed this new episode, and if you did, please tune in for next.